I'm Vincent from Fangano Island. I represent the adolescent and young people in the program known as Local Innovation Spread Through Enterprise Network. Now, this program is one that focuses on bridging the gap between the challenges that the people have and as well trying to incorporate the solutions that are generated by the same individual solution to these problems, that is. And now, this program has been running in Fangano Island for about 2 years on a pilot phase, and we've witnessed immense change, or positive change. Now, just to give you a brief history, Fangano being an island, a lot of NGOs and programs do not usually come because they're hard to reach areas. But Listen has come at a time when we really needed somebody who would bridge the gap, and bridge the gap in terms of capacity building the youths and adolescents with regards to sexual reproductive health rights. Because in the recent past we witnessed that teenage pregnancy is on the rise, sexually transmitted disease is on the rise, child mothers are on the rise, defilement are on the rise. But how would we bring an end to this? Now, this Listen program acts as a solution to this. That is to say, Listen brings a lot of government departmental agencies and heads. These heads come and we articulate our problems to them. We help them in identifying our own problems and as well propose solutions to these problems. Now, in so doing, we give them, we say, hey, we have teenage pregnancy on the rise. Now, we think we can curb them by maybe teaching the youth on correct and consistent use of condom whenever they choose to have sex. Because one thing that is coming out very clearly, these youth and adolescents are sexually active. Again, others are raped, some are defiled. And when they are raped, they become vulnerable. They can contract this AIDS, they will get pregnant. Now, we notify these various government departmental heads on the same, and we generate the solution to this. Now, with such, they go deliberate and see if they concur with us. Now, if we try to look at how this has worked, we realize that recently, or let's say towards the beginning of this year, we've noticed that the youths are really consuming the condoms. That is to say, when NAC or Listen gives us boxes of condom and we distributed them at the condom dispenser, we realized that there is high uptake, such that within a month we realized that the condom were depleted. And again, on the same note, we noticed that teenage pregnancy the numbers are not rising as compared to previously. And so, to that regard, or to that extent, we say Listen is very effective. Another thing that we notice is that as youth, we formed a slogan called "Come Out, Speak Out." Now, "Come Out, Speak Out" targets the youth. We do inter-sublocation tours. We visit youth, let's say 30 per sublocation. We educate them, because amidst us we have peer educators, we have counselors, we have various expertise. And so through Listen, because we are empowered, we cascade this information to various youth at their different sublocations. And now, during one of our tours, we realized that certain perpetrators, individuals who chose to defile girls, were just going scot-free. And to that effect, we went and approached the divisional officer, which is currently known as Assistant County Commissioner, and such perpetrators were held. And now 2 matters are on court as far as defilement is concerned. Now, what I'm trying to say is that we have had a change of mind over time. The way we used to view things, our perception of maybe teenage pregnancy, our perception on use of condom has quite improved, such that we know that unless you keep your health, you can't be wealthy. Because as Listen knows, health is wealth. There is a need for a large number of facilitators. We are few, and maybe the resources are less, but we need to reach, because Fangano and affiliate islands, when I say affiliate islands, there is Takawiri Island, Ringiti Island and Remba Island. These islands have got youths who are not very much informed. So we need to scale up our operations, reach those islands, reach those youths, because if Mfangano Island alone we tackle the issues of sexually transmitted infections among the youths, but the figures will still increase because data from let's say Takawiri, Remba and Ringiti Island are still combined together under Mfangano because we fall under Mfangano ward. So we need to scale our operations, reach out even to the other island. As such, this information and change of mind will be meted to them, and we shall develop together collectively.